American Heart Month. Heart disease and strokes are two of the most deadly conditions, and understanding risk factors for heart disease and how to live a heart-healthy lifestyle are a part of practicing self-care for our hearts. And today we are joined by family medicine physician, Dr. Paige Moore. Thank you so much for joining me.
Of course, thanks.
Tell me why this topic, why is it important?
Well, as you know, the leading cause of death in women and in men in the United States is heart disease, and most of that is preventable. And so that means that it's, to some degree, we have control over whether we develop heart disease or not, and that's pretty powerful.
So like you mentioned, this isn't only affecting women here, it's also affecting men.
Yep, #1 leading cause of death in women and men in the United States.
Yeah. Well, does the symptoms or this really differ between the genders?
Yeah,
that's different.
It's a good question. So women tend to have atypical symptoms of heart attacks, so they're a little bit more vague. So they can be anything from upper abdominal pain to back pain to extreme fatigue. And I think it's important because they're easily dismissible, right? Is this heartburn? Is this a stomach ache? Women also have the symptoms that we usually think about when we're talking about men having heart attacks, and that's the chest pain and the pressure and the tightness associated sometimes with left arm pain. But more typically, women have those vague symptoms.
So it's very important to get regular checkups. What are some tips that you can give us here?
Yeah, well, I mean, first of all, you need to know your risks, and risk factors in women and men do overlap. So it can be, many of you know, heart disease is, you're at higher risk for heart disease if you have elevated cholesterol, diabetes, you smoke, you have excessive alcohol intake. Some of the other risk factors for heart disease are more specific to women. So women who have had pregnancies that are complicated by hypertensive disorders or gestational diabetes. Women are more likely to have, more than men, have autoimmune disorders, and those put you at a higher risk for heart disease as well.
Is there a specific reason why women are more prone to that?
Well, which one?
Oh, well, the second part that you just mentioned.
Yeah, well, some of it has to do with estrogen. So we are at increased risk after menopause as well. So it's thought to be reproductive age helps us, the estrogen as far as the arteries. But in addition, women tend to have heart disease or manifestations of it about 10 years later than men. For those reasons. Does that make sense?
Yeah, well, is there anything else that we're missing in regards to looking out for symptoms, getting checkups, anything that we're missing that we haven't covered already?
Oh, absolutely. I mean, do you have an hour to talk about how to decrease risk factors?
Let's do it.
Okay, really quick. So, I mean, this is probably this is where all the fun is, right? And so, all diseases aren't preventable, and heart disease is. And I think this is where I can give you a really easy answer of how to decrease your risk of heart disease, but it's really a lot more complicated than just doing that. So a patient comes in and I say, oh, you know what? You have high cholesterol, you need to change your diet, you need to stop smoking, I'd like you to decrease your alcohol consumption. Simple sugars and sweets need to be eliminated from your diet. No stress, that's their favorite when I say you need just to decrease your stress. You know what, that's really difficult, right? So we all have those, and we all have reasons that maybe it's more difficult to exercise or more difficult to eat. I'm going to put a plug in for lifestyle medicine here. So Dr. Jennifer Schall's, she has started lifestyle medicine department with St. Luke's, and it's focused on all of those things. So it's focused on decreasing stress, increasing your physical activity, changing your diet, and it's powerful. I mean, the amount of diseases that we can decrease, including death. It's not just limited to heart disease. You can decrease your risk of cancer, osteoporosis, kidney disease. So I think that a lot of my patients and myself, we're human, and it seems overwhelming sometimes to make all of those changes. And if peanut M&Ms are on sale at Costco, I'm going to put them in my cart. So I think we give ourselves grace, and just remember, you walk a couple extra minutes a day, and you can incorporate that in little meaningful ways.
Yes. Well, thank you so much for joining us here on the News at 4.
And
we have some tips over on our website right now at KTVB.com. But for now, we're gonna go to break, and then we'll be right back.